If you're like me and you've got private insurance and benefits, you may be scrolling through what is covered and wondering what you could get treatment for, especially as the year gets closer to the end or at the start of the year when our benefits reset themselves. One of those things that you may be wondering if you need it or not is osteopathy. What is it? A lot of people don't know what it is. Well, I'm here with a practitioner who's going to answer one of those some of those questions for us. I'm here with Mitchell Lawrence. He is an osteopathic manual therapist at Reset Osteopathy at the Medicine Tree in Lethbridge. Mitchell, welcome.
Hi there.
So first off, can you just tell us a little bit what osteopathy is?
So osteopathy is a holistic manual therapy and it aims to identify and treat various different conditions, injuries or just pains that you might have. We use a wide range of different techniques ranging from joint mobilization and articulation, massage techniques, releases for different muscles or complexes, as well as exercises, all of which are prescribed to the individual's needs.
So what specifically does it treat, and can you give me some examples?
So there's really no exhaustive list of what it can and can't treat. We see people with arthritis, headaches, just lower back pains and aches. We also treat nerve conditions such as sciatica or carpal tunnel, for a few of the more common ones you might have heard of. But then we can also treat things such as recovery from surgery or injuries, or such as joint replacements, things like that.
I've heard some people compare osteopathy to kind of like a merger between massage and physiotherapy and chiropractic. What would you say? Is that an accurate description?
Yes, a lot of people describe it in that way, probably due to the techniques that we use. We use different soft tissue and deep tissue massage techniques, but we also address the joints and the spine to try and release tension in there. But then we do give exercises as well, and these are suitable to everyone and they are prescribed differently. So that's the physio component that a lot of people would say, but really the combination of all of them is the way that we do our treatments.
So if someone has, say, lower back pain and they've got they feel a lot of tension in there, their muscles are tense, what's the benefit of osteopathy versus just going to see a massage therapist?
So we work holistically. So that means we won't just look at the lower back. We will maybe look at your mid back, into the areas below it, into your pelvis and hips, but even down into your legs. We also look at lifestyle, previous injuries, because all of these can either predispose or maintain the injury that you currently have. So really using all of these components helps to get to the cause of what's going on, and that will make treatment more thorough and more effective.
Okay, so I'm curious to learn more about this, and I mentioned lower back because I'm a person who's a side sleeper, and when I'm sleeping on my side, sometimes I wake up in the morning and I've got pain in my sides and it radiates to my back. I do get some relief though with a pillow between my legs. Can you just explain what's going on?
So what the pillow will do is help to keep a more neutral spine and pelvis. When we are sleeping, lots of people will sleep in ways that could compromise their lower back or other areas such as their shoulders or neck. But the pillow is a really simple thing to do that can go between your legs. It shouldn't cause too much discomfort or affect the way you sleep, but it will make you wake up and not feel potentially as stiff. And then you could use that alongside exercises, for example, that we give, and that will help you get going in the morning.
It's funny that you mentioned pillows because it seems like one pillow is not enough, but two pillows is too many. Have you heard that complaint before?
Yes, and it takes our body time to adapt as well. So you might try one pillow, it might be not enough, two might be too many, but after a couple of weeks, two might be perfect. It's all different based on the individual.
So it's great that you're explaining all of this, but I'm more of a visual guy, and I'm obviously some of our viewers here are as well. Do you mind demonstrating some techniques on me, and just so the viewer can see what exactly happens during an osteopathy session?
Of course.
All right. So I mentioned I've got some lower back pain from the way I sleep. Some neck strain. What do you recommend you perform on me today?
So first we'd have to look at how the joints are moving. So to do that, I will get you to do some movements, and then I will do some movements for you. Then I can have a palpation in the area that's affected, and using your feedback, we can identify what is painful, and from that, we'll then get into treatment.
Okay, great. All right, let's do that.
First, would you just be able to stand facing the other direction, just so I can have a look at your back, please? Okay. So I'm just going to place my hands on your hips, if that's okay.
Okay.
And so I'm just checking the levels of different landmarks in your hips, your pelvis, and your lower back. Is there any pain when I'm pressing in there?
No. It actually feels kind of nice because it's like a mini shiatsu when you're pushing in like that.
Almost like a little bit of relief.
Yeah, like a micro massage.
Yes, I understand. And then I'm just going to get you to take a seat here, please, if that's okay.
Okay.
So if you could just cross your arms like that.
Okay.
Good. And I'm just going to reach my arm around the front here.
Okay.
I'm just going to be rotating your back.
So here I can see like the physio side of osteopathy.
Yeah, what I'm doing right now is analysing how different parts of your back are moving. You mentioned how you've got that lower back discomfort, but sometimes we have to look elsewhere, and that could be contributing to what you've got going on.
Okay.
So would you be able to lay on your back now, please?
Sure.
If that's okay. And so we've just got, and then one leg at a time, I'm just going to lift your leg up straight. Do you feel any pain shooting down the back of your leg?
No, I just feel stretching.
Feel some tension? And if I lower your leg and pull your foot back, and then your toe, is that okay? No shooting pain? Good. And we're just going to compare the other side.
Okay. Just stretching.
Same, just that stretching. Okay, good. And then the foot and the toe. Is that okay?
Yep.
Good. So if you could roll onto your side facing me, please.
Okay.
I'm just going to take your lower back through the same movements that I've got you to do, standing up.
Okay.
So I'm just going to bend your legs. Good. And then I'm just going to move your legs towards and away from your body.
So what does you doing this versus me doing it accomplish?
So when you are doing it, you are actively doing the movement, which means you are activating the muscles as well. When I am doing it, you are passively doing that. So what it means is that your muscles aren't engaging, and I can have a better look at your true range of motion in the joint.
Okay.
Because sometimes if the muscle is the limiting factor, then I will be able to produce more movement than you would yourself.
Yeah, and earlier I said it feels like I'm doing a bit of physio. Now it feels like I'm getting a massage.
Yeah, this technique that I'm doing right now is a soft tissue technique, and it aims to just promote a bit of blood flow, break some tension in between the muscles. And what that will allow us to do is then move your joints and really release any tension that's in the joints as well.
Typically, do you have a certain type of client that you attract the most, like athletes or business professionals, or people with sedentary lifestyles, or people with very active lifestyles?
I get asked that question a lot, actually, and the truthful answer is I see all sorts of people. I see a mixture of young athletes, parents who have just got stresses from work, maybe injuries, or just from life, but also elderly people who have been having more chronic issues for longer. So yeah, there's no real trend to who we see. It's a really wide range of people.
That stretch you just did felt amazing.
Good, that should be helping to open up and release your lower back, but also into your pelvis.
How would osteopathy be complementary to someone who also visits a massage therapist and or a chiropractor?
So what we can do is we'll ask the patient maybe what their massage therapist or chiropractor is working on, so that we can then use that to guide our practice. But it will just help to further relax some muscles, release some tension in joints, maybe in between osteopathy appointments. So some people might come for an appointment once a month, but then in between that might go for a massage just to reinforce that relaxation.
Because I've heard that if you combine a chiropractic adjustment with a massage, the adjustment holds longer. Is that the same with osteopathy?
Because we do multiple techniques, a lot of people say that they feel after a session, it's almost as if they've had a chiropractic adjustment and a massage, because we work on the joints, not just the spine, but all the joints, as well as the muscles. So a lot of people would almost describe the effect of an osteopathic session to be that of a chiropractic and massage together. So I'm just going to do a little bit of work on your neck now. So I'm just going to see how it's moving first.
Sure.
So if I just turn your head that way and then the other way, do you see how it doesn't want to go that way?
Oh yeah.
As much.
Yeah. Is it because of side sleeping?
It could be many different factors.
Or like my pillow?
That could be a factor. Lifestyle, work, maybe previous injuries. There's lots that could be contributing to it.
I actually had a dull pain in the top of my head, and I didn't really notice it until it started going away just now. So have we become somewhat desensitized to pain?
Some people, if they've had chronic pain for a long time, the body's response to pain can change. And so some people might feel that something is less painful. Some people's bodies could get more sensitive to pain. So a stimuli that maybe wasn't sensitive in the past could now cause pain. And that's very different for every person.
What kind of training do you need to go through in order to get into this type of work?
So I trained in the UK, in Wales, and my program was a 4-year integrated masters course at Swansea University, and that's 4 years all in one go. And as part of that course, we have to do 1,200 hours of clinical practice.
Wow.
And so that is the way that you can then graduate, and after that you go straight into work.
So we know that chiropractors they have to follow regulations, same with massage therapists. What about osteopaths, or in your case, an osteopathic manual therapist?
So here in Alberta, our regulatory body is the Alberta Association of Osteopathic Manual Therapists. So we have regulations with them regarding insurance, treatments, right to practice. That's different province by province, and so it depends whereabouts in not just Canada but whereabouts in the world you are. But a lot of the regulatory bodies will be very similar in terms of right to practice, what you are and aren't allowed to do as an osteopathic manual therapist.
So obviously we've been through some techniques here, and I must say, like, I do feel a lot more like my joints are more fluid. I can move a lot easier. Typically after an appointment, what would you recommend that a patient does to keep things kind of like well oiled?
So we try and work with what a patient would usually do in their daily life. So we try not to say that they have to limit or restrict their activities, but usually after an appointment, taking it a little bit easy is a good idea, just so that we don't strain the body. It just gives that body time to respond to the treatment, but from the next day, they can get back into their normal routine, back into training, working, whatever that might be.
Mitchell Lawrence is an osteopathic manual therapist. Mitchell, thanks so much for your time today.
Thank you for having me.
I'm Naveen Day. On behalf of all of us here at Bridge City News, thanks for watching.